Welcome to the deep dive. Today, we're tackling a really sensitive subject, bleeding during pregnancy.
It is, yeah. Causes a lot of worry.
Exactly. So our mission here is to clarify things, figure out what's, common and maybe okay versus what needs urgent attention. We've looked at the sources to give you that vital info. Okay, let's unpack this.
Right. And what's fascinating here is understanding the nuances. It's not always straightforward.
No.
Sometimes it can be normal, part of the process almost. But other times, well, it's a serious warning sign.
So knowing the difference is key.
Absolutely. Knowing the potential causes, when to act, that's empowering for expectant parents.
Okay, so let's start at the beginning. Early pregnancy, that first trimester. Our sources mention some bleeding can actually be, well, normal. What are we talking about there?
Yeah, that's right. In those first few weeks, light spotting isn't necessarily a bad sign.
Like what, specifically?
The most common example is implantation bleeding.
Ah, right.
That happens maybe 10 to 14 days after conception. It's the fertilized egg settling into the uterus lining.
And it looks.
Usually very light, maybe pinkish or brownish, and it doesn't last long, generally harmless.
Okay, that's reassuring, but obviously it's not always implantation bleeding.
No, definitely not. And early pregnancy bleeding can signal problems. The most common serious cause, unfortunately, is miscarriage. Our sources say it affects about, maybe 1 in 4 pregnancies, mostly in that first trimester. Often comes with heavier bleeding, more like a period, and cramping.
That's tough, but important to know it's common.
It is, and then there are other rarer but very serious causes, like ectopic pregnancy.
Where it implants outside the uterus.
Exactly, usually in a fallopian tube. That's a real emergency. It causes pain, bleeding. It needs immediate treatment. It can be life-threatening. And there's also molar pregnancy, less common again, where abnormal tissue grows instead of an embryo.
Got it. Are there less serious things too?
Yeah.
Besides implantation?
Yes. Sometimes minor things like infections or even just changes in the cervix can cause a bit of spotting, especially, say, after sex or a pelvic exam. But here's the really crucial bit. If you have bleeding and severe pain or pain in your shoulder tip or you feel faint or dizzy,
Yes.
that's an emergency. Get help right away. Don't wait.
That's crystal clear.
Yeah.
So, moving past the first trimester, bleeding later in pregnancy, how do things change then? Is it generally more worrying?
It tends to be, yes. Bleeding later on second or third trimester is less common overall.
And potentially more serious?
More likely to signal a complication, certainly.
Ew.
If we connect this to the bigger picture, it often involves the placenta.
Okay, like what kind of issues?
Well, there's placenta previa. That's where the placenta is lying low, maybe covering the cervix.
Right.
That often causes painless, sometimes quite heavy, bleeding, usually after 20 weeks.
And placental abruption. I've heard of that.
Yeah, that's another serious one. The placenta actually starts to detach from the uterine wall before birth.
Oh.
Causes bleeding, often pain too, and it's risky for both mother and baby.
Scary stuff. Anything else?
Bleeding and cramps could also mean preterm labor starting too early. And then there are very rare but very serious conditions like placenta accreta or vasa previa, usually picked up on scans.
So complex issues, often needing specialist care.
Definitely. But, even later on, simply things like cervical polyps or infections can still cause some bleeding. The rule remains, always get it checked.
Right. So what does this all mean for you listening right now? If you notice bleeding, any bleeding, what should you do instantly?
Okay, first step. Try not to panic. Easier said than done, I know.
Sure.
But remember, light spotting can be okay. Next, make a mental note, or even a real note. How much bleeding? What color? Is it pink, brown, bright red? Is it getting heavier?
Good practical advice.
And are there other symptoms? Pain, cramps, feeling dizzy or faint? Did you pass any tissue?
Okay, gather the info. Then what?
Then you always call your doctor or your midwife or the maternity unit. Always. Even if it seems minor, let them know what's happening.
Don't hesitate.
Never. And this is the emergency part, if the bleeding is heavy, like soaking a pad quickly, or if there's severe pain, fainting,
Yeah.
that shoulder tip pain we mentioned,
Yes.
go straight to emergency care. Immediately. Don't phone first. Just go.
Got it. And they'll figure out what's going on.
Yes, they have ways. Blood tests, ultrasound scans, maybe an examination. They'll check you and the baby thoroughly.
That's really helpful step by step.
Huh.
So the main takeaway here is be aware, know the signs.
But absolutely never delay getting medical advice.
Right. Peace of mind is vital too.
Exactly. And it's worth repeating what the sources emphasize. Many, many women experience some bleeding during pregnancy, and everything turns out fine. They have healthy babies.
That's important reassurance.
It is, but vigilance is key. Which, this raises an important question for you listening.
Go on.
How can understanding these possibilities, the normal and the worrying, actually empower you? How can it help you advocate better for yourself and your baby when you talk to your doctors armed with knowledge instead of just anxiety?
That's a really powerful thought to leave people with, knowing what to look for and what to ask. This deep dive has been incredibly useful. Thank you for joining us.